Sarah. How are you
Hi.
today?
I'm doing okay.
Good. Well, I'm Celeste. I'm going to be one of your nurses today. We're just going to ask you a couple questions.
Yeah, I'm Julia. I'm a nursing student working with Celeste today.
Okay, hi.
Yeah. So tell us what brings you in today.
Well, I'm starting to worry about my health. Maybe for like the last 6, 7 months, it's been kind of hard for me to concentrate. I think I'm gonna lose my job. I think I might have some health issues that I don't know about. I can't concentrate as much, so I just thought I'd come in and talk to a doctor about it.
Sure. Okay, so you're having trouble concentrating, just kind of worried that something might be wrong. Do you have any physical symptoms?
Sometimes I just feel like my head hurts, my heart's beating really fast. I feel like my chest is gonna pop out of my heart's gonna pop out of my chest sometimes.
Okay.
I get scared when I get into the car to drive to work that I might get into a car accident.
Okay. So it sounds like there's a lot of maybe fear and worry around some things.
Yeah.
Yeah.
I worry about my job because I've been calling in a lot. I haven't been able to concentrate, so I've been going home sick.
Oh.
And then so now I'm worried about paying my bills. You know, I'm worried about buying food,
Okay.
and it's just everything is just piling up. So
What do you do for a living?
I work as a nurse's aide,
Okay.
Okay.
and so sometimes looking at the patients too, I worry for them, and then I worry for myself, and
Yeah.
I always think about what's gonna happen to them when they
Okay.
leave. So
Yeah. That must be hard
it
to
is.
have that kind of constant worrying. And you said that's been going on for 6 or 7 months, about half a year,
Yeah.
pretty consistently.
Yeah.
Describe how often.
I would say about 4 times a week. I can't sleep. I eat or I don't eat at all, and sometimes I think I eat way too much in one setting.
Okay. What seems to help you feel better?
Sometimes eating helps me feel better.
Okay.
I don't know. I guess I haven't really tried anything to help me feel better.
Yeah. Well, it's got to be kind of hard if you don't know quite what's going on to really understand what would make you feel better. But what makes it worse? Maybe that would be easier to answer.
I guess watching the news, because all the bad things happening, I start to worry more. Maybe around the time that I'm supposed to pay rent and I don't have enough money, so I worry more. And then, which makes me worry more about going to work when I get in the car, so I don't know what's going on with me. I just get scared all the time now for some reason.
Okay. Have you had anything change within the last year? Any big life changes that could have prompted this?
I think because I'm by myself now, me and my boyfriend broke up maybe a year ago, and just being there and doing everything myself, and then not really having anybody there to support me, and trying to get into nursing school too. I guess I don't even know if I can do that now because I don't know how I'm gonna pay for it.
Okay. Yeah. Well, those things do sound stressful. And this is kind of a hard thing to talk about, but I know a lot of times with worry, it's common to have feelings of hurting yourself or harm. Have you had any thoughts like that in the last couple months?
No, I don't want to kill myself or anything. I just worry that something's going on with me.
Yeah.
Like, I don't know.
Yeah.
I just don't feel happy or like I used to feel. And I just get really anxious at some points, especially getting in my car and going to work. And sometimes when I'm at work, just seeing other patients, how ill they are, it just makes me worry that I'm going to be ill like that too.
Okay. So you mentioned that it's affecting your job a little bit, that you go home because you're not feeling so well. How has this affected other social relationships for you?
I guess people at work are really mad at me,
Mm-hmm.
and so that kind of makes me not feel so good. I do talk to my sisters. They've been supportive, and that's it. My parents aren't around as much, so I don't really talk to them, but
Okay.
that's it.
Okay. And then you mentioned that it's been kind of changing your eating habits.
Mhm.
So how have you been sleeping?
Not so well. Some days I can stay up for 36 hours because it's hard for me to sleep. Maybe I'll get in 1 or 2 hours of sleep. And then some days I feel like I just want to sleep all day, but I'm just so anxious that I can't fall asleep. My mind is always thinking about what's going to happen to this, what's going to happen here, what is this, it's just my mind won't stop thinking.
Okay. Okay. Well, thank you for talking to us. I know it can be hard to come in and then to share the things that you've been feeling, especially just talking about mental health. It can be hard. So we really commend you for coming in today. We're going to go grab the doctor. He'll be in to follow up with you, and then we'll hopefully be able to come up with a plan of care for you and help you feel a little bit more back to yourself.
Okay, thank you.
You're welcome. Knock, knock, knock. Hi again, Sarah.
Hi.
Hi. So, it looks like the doctor's diagnosed you with generalized anxiety disorder. I'm sure you kind of talked
That's what
with
he
the
told
doctor
me.
about that. So, we've got a medication for you to take and just some tips in dealing with that anxiety. So, I'm going to let Julia talk to you about that, and we'll get you going on with your day.
Okay.
Okay, so the drug that he prescribed for you was sertraline, which is an antidepressant.
Okay.
So this you're going to take once daily in the morning or evening, so whatever you choose, just take it at the same time every day. And it may take a couple weeks to work, so if you take it and you don't notice anything changing, then that's why. This medication may make you drowsy too, so just to remember that with driving and stuff, kind of pay attention to how it affects you before you start driving or doing anything like that.
Okay.
Just continue your normal diet. It doesn't interact with any foods or anything like that, so you shouldn't have to worry about that. Some common side effects you might see are going to be the difficulty falling or staying asleep, which I know you already have troubles with, so that just might be a normal for you. Constipation, dry mouth, and then some weight changes too with that. And so with some other side effects, if you have any of these, you're going to want to call your doctor right away. So if you're having any seizures, any abdominal bleeding or bruising, any agitation, any hallucinations or rashes, hives or swelling, anything like that, just go ahead and call your doctor right away and they will tell you what to do from there. So any questions?
So can I stop taking it once I feel better?
No. So this medication you're going to have to take as exactly as directed for as long as your doctor wants you to. So even if you do feel better, we do encourage you to continue.
Yeah, so just really quickly, some other things you can do besides taking the medication. You can do some relaxation techniques. I think we have some handouts for you today.
Yeah, there's that for you.
Yeah, just on things like meditation, we can refer you to a counselor just to kind of talk through your anxiety. There's group counseling that you can do for other people with the same issue that you have.
Okay.
But just making sure to stay relaxed, and a lot of self-care will really benefit you.
Okay.
Well, good luck, Sarah. Thank you for stopping in today.
Thanks for your
Yeah, I
help.
hope you feel better.
Thank you. Me too.